Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to talk to you this morning about the temporal mandibular joint. This is something that so many people do in orthodontics and doing regular dental work or anything that you work around in the mouth. They tend to leave the temporal mandibular joint out. They don't want to, they may not understand how it works, and so a lot of people just ignore it and act like their patients aren't going to have this. But you have so many people that do get damage to this joint, and I wanted to cover this thoroughly. So people, if you mess with the mouth, I don't care what you do with it, you should know something about the temporal mandibular joint and what really causes most of the pain. Now, you can have arthritis and you can get damage from trauma and stuff, but most of the time it's where the condyle goes out and puts too much pressure on this retrodiscal tissue, and it's highly vascular and it gets inflamed, and that's where the pain really comes from. So I'm going to get over here and we'll push this little play button and show you something about it. This is just an overall picture of the joint. I'm going to cough every now and then. This is your condyle coming up. Let me see what I have to touch here. Okay. Now the condyle, I'm going to draw here with my finger, comes like this. And this is the fossa up in the temporal bone coming around like this. Now when you open your mouth, this condyle is going to slide forward, and this is the disc that's in between here. We call it biconcave disc. It fits up like this. It has an attachment in the top back here, and also it has an attachment further down here on the condyle. There's an upper joint space and there's a lower joint space, and this little disc is so dense, and it's a dense connective tissue, and it will last all your life. Now, I have this, and I'll soon be 95 years old, and the disc is still intact here, and it can heal itself, and it's fed from this synovial, this retrodiscal tissue in this area. When it kind of squeezes, that tissue comes into the bottom and into the top joint space as this gets out. This thing gets pretty complicated, but I want everybody to understand something about it, because I don't give a hoot what you do in this area. You can have effect on this jaw joint back here, and it'll give you a problem. So I'm going to go ahead and move out here. Whoops. Screwed up there. I don't know. Okay, here we are again, and I'm going to watch this and this is a video, a high-speed picture really of cut-downs of the joints done by the university in Sweden, and there are two gentlemen that are showing this, and it's one of the best things I've ever seen to explain the jaw joint and how it works. So I'm going to go ahead here. This is going to be an actual healthy joint that you're going to see working in this picture here. Let's just watch this for a minute. Now this is the condyle right in here, and it's going to open, and the retrodiscal tissue now is up in this area, and of course here is the fossa, and when the person opens their mouth, this condyle is right here. It's going to move over, and the disc is right in this area. You can see this kind of a double concave, so it fits both, and it is lubricated with this retrodiscal tissue back here, puts the food stuff here where it's fed, and is also lubricated with this retrodiscal tissue. Squeezes that into this area and also into the upper joint space and the lower joint space. Now I'm going to see if we can go ahead and move this out again, and you can see it open. And now we're going to stop it right here, and you will get a better look of the shape of this disc in this area. And this is the attachment where the disc is attached down here, and it's back up here. Now the condyle will go all the way out here. Now if you stick your teeth forward, like you bite something with your front teeth out here somewhere, and you bite your front teeth together, your back teeth, your molars and your bicuspids, everything don't touch at all. So the load on the front teeth might be, say, 10 pounds of force you're putting up here. The muscles that pull the jaw up and down, everything are back in the back part of it. Then they're around the second molar and the wisdom tooth where they're picking it up. So you have to have a lot more force back there in around the joints than you have on the front teeth. And if you want to chew something hard, you bring your condyle back up here and you bite on your molars and bicuspids, and then the load goes up through the bone structure and doesn't give you the problem that it would give you if you try to chew it out in the front. And a lot of times you advance the mandible, you have to put something in between the teeth here. That's what the splint does. Let's go ahead and start going again from here, and I'll play this, and you see it go out. Now to go back up, and that disc goes in, and now it squeezes the lubricant and the food structure into the disc. And now this is about where your mouth is open, about like that, and this ligament holds it in here, and it also catches down in this part down here. And now let's start this again, and we'll see it come on. Now this is now you remember, this is done on cadavers for people that donate their body to science, and they trim this down real soon after they pass away. And so this whole thing is trimmed off in this area right in here. And so you have to think of this not in a flat manner, but as something that is round. The fossa and the place where this synovial fluid and everything is up in here, and this goes back in there and it squeezes that fluid in here with the food and the lubricant on the joints, and they work, and everybody has these. But then we're going to show you some that break down. And if you push this together and hold it tight like this for a few weeks or just a few days, you will starve this tissue to death. It is so tough that it lasts your whole lifetime. But you starve it and it'll die. And I've talked to old surgeons that said when they go in there and look at this that's so tough, they can just scrape it like cheese. It's dead. But there's no nerve endings, and there's no blood vessels in this disc itself. Let's go ahead and pull it on down a little bit further. Now right up there, that's as far as it goes up. Now when it wads up. All right, now we're going to show another disc that is worn out really, or else somebody tied this together right here. Let me stop that. In other words, they may have had their jaw operated on and they wired it together, and it may have starved this disc, and so there's going to be a hole in this disc. We're going to show it here in just a minute. Now we'll go ahead and move this on up a little further, and then you can watch. Now this is a disc that's going to, you'll hear a scraping noise where the tissue is kind of bone on bone here, with a little bit of a covering that you've got on the condyle and the fossa. Now this is the teeth are out in this direction here. So it's going backwards from what we were a few minutes ago. And this is the retrodiscal tissue back in this area right here. Let's go ahead and move it again. And you'll see this. Now this type of joint, you can hear it kind of scraping like it's not smooth like a regular one. Everybody ought to wear a mouth guard who have any kind of activity you do where you might get hit in the jaw. Is keep from jamming this condyle into this area back here. You can damage the joint, and you can also, that's the way you get knocked out. It's very thin bone structure here, and your brain is back in this area there. So everybody ought to wear a mouth guard or whatever you're doing, and have it in the upper arch. Let's go ahead and move this again, and I'll show you. They're going to lower this joint down, and you can see the disc where it's worn out. It's either worn out or it's starved to death, and the condyle axis where it contacts the fossa has no covering over it at all in that area. So if we stop this, you can see the disc has got a hole in it. It's kind of like that, and we'll see that in just a minute here. Now, I'm going to stop it here. This is this biconcave disc. It was around like this. Now I want you to think this portion out here is cut away. And so think about it in 3 dimensions, as if it's a round or something that goes in and out, and we're just looking at it with the edge cut off on this side here has been reduced. So this disc really went all the way around like this, and this part right here has got a hole in it, and this bone structure is just sliding back and forth on that. and you can hear the disc. And the disc either wore out from some reason or another, or somebody may have clenched and pressed it together, or else if the jaw was broken and they wired it together, the synovial fluid can't get food to this part of the disc, and it'll die. And that's what you end up with there. Let's go down. We'll see one that's clicking in the way it'll do. Now this one is going to slide off to the inside. See, and people that you're going to feel it click off. Then it's going to pop, and it'll go, and you can hear it pop back up out. And then if you listen real careful, you'll feel it slip off. And that's, when you get one that's doing that, it pops on up here. If you get one when it pops on real quick and get a splint in there and hold it on there, this disc, which is normally concave like that, gets flat when it slides off and on here. And that's you do away with the concave, tends to keep it in place better than just a flat disc like that. Let's go ahead and we'll move it from there. That's going to jump to the inside. See, now you open your mouth and you'll hear it right there like that. Okay. And if you're doing anything in the mouth, whether it's dentistry or extractions or surgery or whatever it is, and you think you don't have any influence on this jaw joint, you're so wrong. I'll show you case after case where the jaw is locked back. Now here's one that's the disc is just worn out completely, and I'll go through it. I don't want to take too much time, but I am interested in that people who are going to work on the teeth, and if you're going to try to do orthodontics, you need to understand this temporal mandibular joint. It is the most complicated joint in the whole body. Now this disc in this particular person, when they cut this down, the disc is just almost gone. See, you can see a piece of it up here and a piece of it down this further. Let me let it go ahead and open. Now that disc is just completely gone. Now here's another one. Now we're going, this is the condyle now. Let me stop it. And whoops, the condyle and the jaw's out in this direction. That gets you confused going back and forth. And this, of course, is a different fossa. And but it'll have a disc that works on that. Let me crank it up again here, and you see the disc slide off like that. Now, probably in life it didn't do exactly like that. We have reduced this part of the picture's been cut away, see. But anyway, that's the way the thing functions, and you ought to know about that. Now let's go ahead and finish this out. And I am just interested in people doing orthodontics if they do it properly. And I know so many people that say, well, I don't pay attention to this because everybody doesn't have the problem. But there will be people that have a slight problem and you won't even know about it if you don't understand. And watch this thing slide off again and it'll slip back on again. And that is something that's happening all your life, and you chew on that, you get it irritated, and you keep working on it, and you'll have pain in your shoulders, your neck, your headache, and all these other things. And it's similar if your vocal cords get inflamed and you keep using them that way. So anyway, you need to know something about it because you have an effect on it, on different things that you do. Okay, we'll just go ahead and carry this one right on to the end of this. And I hope you are able to see this and don't think of it as something flat. Now this goes all the way. You just have to think of it as in the third dimension here. Now this is one that is really worn out. And the condyle, if this is the fossa now, and then let me stop that. The fossa flattens out, and the condyle had the beaks out like this, and it just slides bone on bone all the way. I had a patient one time that they had a click and a problem, and it was bothering them a little bit, but I told them it needed a splint or something, and they never did anything. And about 10 years later, they came back, and the lady said, well, this thing bothered me for quite a while, and then it just quit bothering me. But now it's making a little noise over here, but it didn't hurt. And what happened, the condyle, instead of it being around like this, it just beaked off like that. And the fossa did too. And the bone structure just, let me run it on down here and you can see how it does. Now, see the bone structure just smoothed out. Now this doesn't hurt people, but they're going to have this noise. You'll feel it scraping back and forth. And this is the university in Sweden that provided this video, and it is one of the best things I've ever seen to explain what's going on here. So I'm going to say goodbye, and I hope you get something from this. You should know something what's going on here, and I'll hush up and close this out, and thanks for watching, and I want you to join our